Hey everyone, this is Reggie from Result Plus Physical Therapy. And in today's tip of the day, this one is a question that not a lot of people ask. Like I see a lot of patients in the clinic who had knee replacements. Not a lot of them ask me this question. Not a lot of people are concerned with this issue. Although the ones that have asked, I definitely understand where they're coming from. And the ones who didn't ask, when I mentioned this to them, they are very welcoming that I gave this suggestion, gave this advice to them, and I want to share that with you. Okay, so if you've had a knee replacement, a knee surgery, or actually any kind of surgery, I want you to listen in because this has something to do with the scar. All right, so what are things that you can do to make the scar look better? So what are things that you can do for a softer, better looking scar? There's two things that I recommend doing. So first is, let's say for example, you have a vertical, let's say the incision is vertical, okay? So just go, play along with me here. So if the incision is vertical, first is I want you to do what we call a cross-friction massage or scar mobilization. Now, how do you do that? So let's say if the scar is vertical, I want you to put two fingers. I don't want you to line them up. So they're horizontal like this, but I don't want you to line them up because if you push them together, they're gonna bump into each other. So it's one is above, one is below. Doesn't matter which finger it is, okay? So one above, one below. So the scar is in the middle. So what I want you to do is I want you to push them together like this, overlapping. So if the scar is in the middle, what will happen is you're bending the scar, making it into like an S shape. And you go through the length of the scar. You can start from the top down or down up, doesn't really matter. So just go repeatedly up, down. And then the other way to do that is, so you're doing two strokes. One is that, the other one is, let's say if the scar is vertical, I want you to hold both sides of the scar. I want you to push them, kind of like splitting them up. Okay, so I want you to push up and down, go like this throughout the scar also. All right, so I want you to do those two techniques. 5 minutes, you can do 3-5 times a day. That's 3 times a day, so it doesn't eat up your whole day. 5 minutes 3 times a day, do those two techniques. Okay, that will help realign the scar fibers. It will make it softer, it will make it flatter. Okay, so that's one strategy that I recommend. The second one is then you have to apply cream or lotion. Okay, even regular vitamin E is good. I know some patients they use cocoa. I mean that's okay also, or aloe. That's okay also. Now, what I recommend is something a little bit stronger than that, but it's not prescription grade, so it's not it's over the counter. So the cream is called Mederma. What that one does is when you apply it to the scar, it will make it peel and then it softens and flattens it. Okay, combine those two things together, it will help you have a softer and better looking scar. Okay, so try those and let me know how you feel. Definitely, if you have scars, somebody you know has scars, excuse me, feel free to definitely share this video with them. Help them get better looking scar, get softer scars as well. Okay, so I think they will be grateful. They appreciate when you share this with them. Okay, so I want to hear your comments. If you tried yourself, I want to know what you think. I want to see, want to hear about the results. All right, so thank you very much for your time. Thank you very much for watching this video. Remember, I need you to comment, like, subscribe, and share this video so that you can help transform other people's lives. And also, I can help transform your life as well. And I can help you in this recovery from your surgery, from your knee replacement. I can help that recovery be a little bit easier, a little bit faster. Okay? So yeah, you can DM us, you can email, you can put them in the comments below. We will get those messages and I love seeing them. All right, I'll see you in the next video.